All right. Good afternoon, everyone. Today we'll be studying um, on the topic. We'll be learning on the topic pharmacology. All right. What is pharmacology? All right. First and foremost, pharmacology is two words combined together. Right. The suffix of pharmacology, the ecology part of it, speaks to the study of, and the prefix pharma means the science of drugs. So put it together is the study of the science of drugs. Now, alright. So um, basically, in other words, pharmacology is the science of drugs, including their ingredients, preparation, uses, and actions on the body. Alright. Alright, so you can write down that information. Alright, so some information that um you can use. You don't necessarily need to write it down, but then just to know. Alright, so although the term drugs and medication are often used interchangeably, alright, the term drugs may may make some people think of narcotics or illegal substances. For this reason, you should use the word medication, especially when interviewing patients and families. In general terms, a medication is a chemical substance that is used to treat or prevent diseases or relieve pain. And I repeat, a medication is a chemical substance that is used to treat or prevent disease or relieve pain. Now, with in pharmacology, there is something that all patient assistants must know, right? Um, and these things are what we call now root the roots of administration. Roots of administration. Alright. I really hope everybody can see what I'm writing. Alright, so the roots of administration. Alright. So with the roots of administration, there are two basic roots of administration, right? Number one, you have what we call the ENTERAL, and two, we have the PARENTERAL, the parenteral and the eteral. Alright, so you can note these things, the two routes of administration of medications, right? Alright, so please note for for alright, so with the eteral, yeah, this is basically medications enter the body through the digestive system. Alright, so with the eteral, medications enter this body through the digestive system. Alright, and then with parenteral, the parenteral, medications enters the body by route other than the digestive tract. Right, so which includes the skin or other mucous membranes. Good, so you can note that. So the enteral medications enter the body through the digestive system, alright, and the parenteral medications enter the body by route other than the digestive tract, which includes the skin or other mucous membranes. Alright, good. Alright, so in knowing that, then this is the part where we will put these things into groups. Right, so we have now let's form a table. Alright, so a table with two yes. Alright, so in this table now, right, we can have eteral here, and then we can have parenteral here. Alright, alright, so we have the eteral on one side and the parenteral on the other side. Right, what I'm trying to do now is to yes, get rid of that. Alright, so I'm going to now list the things that will include in the eteral and the things that will be included in the parenteral. Okay, so for the parenteral we have here as we call in IO, and then we have subcutaneous, alright, no, SC, alright, then we have intramuscular, sublingual, and then we have one more, transcutaneous. Alright, for this one, it's only two for the ethereal. It's only two for the ethereal. Alright, so you just have the perirectum, which is PR, and then you have ingestion, gestion, oral. Alright, so these are what we have. We have the ethereal on one side and we have the parenteral on one side, right? Alright, so we said for the ethereal we have two, right? We have the perirectum, and then we have the ingestion, which is the perirectum is the by means of anal, and then the ingestion as by means of oral. Alright, now there are some things that you can note. Alright, so perirectum means by rectum. This route of delivery is most commonly used with children because of easier administration and more reliable absorption. Children often regurgitate some or all of a medication. For similar reasons, many medications that are used for nausea and vomiting come in a rectal suppository form. Some medications to control seizures are administered per rectum when it is possible to administer them intravenously when it is impossible to administer them intravenously. The perirectum route also is used to give some medications when the patient cannot swallow or is unconscious. Alright. So the form or the medication or the name of the medication that is used perirectum is what we call suppositories, right? Suppositories are placed within the anal, and these is the discharge within the bloodstream. It dissolves and then um administers within the bloodstream. All right, the next form is ingestion or the oral form of medical administration. Medical medications are taken by mouth, all right, and enters the bloodstream through the digestive system. This process often takes as long as 1 hour. One of the advantages of using this route is it is non-invasive. Patients are often much happier to take a pill than to have a needle stuck in them. It is also less expensive to use eteral medication than to use parenteral. However, the main disadvantage of this administration route is the unpredictability of the medication absorption. If the patient has an upset stomach or diarrhea, the amount of medication that is absorbed will be altered. Alright, for the next part now, the parenteral part, right? You have the intravenous, the intraosseous, the subcutaneous, the intramuscular, the inhalation, sublingual, and the transcutaneously. Right. Point to note, subcutaneously and transcutaneously are both they intertwine. Alright. They do intertwine. Why? Because they talk about the skin. Alright, so with the subcutaneous is pretty much what we call injection by route under the skin, and the transcutation is medications applied or administered by way of through the skin. Alright, but we'll speak further on those. Alright, so for the intravenous, first one on the list, the intravenous injection means it into the vein. Medication that needs to enter the bloodstream immediately may be injected directly into the vein or into a vein. This is the fastest way to deliver a chemical substance, but the IV route cannot be used for all chemicals. For example, aspirin, oxygen, and charcoal cannot be given via IV route. The next one, intraosseous injection. Intraosseous means into the bone. Medications that are given by this route reach the bloodstream through the bone marrow. Giving a medication by the intraosseous route into the marrow requires drilling a needle into the outer layer of the bone. Because this is painful, the intraosseous route is used most often in patients who are unconscious as a result of cardiac arrest or extreme shock. Most commonly, the IO route is used for children who have fewer available or difficult to access IV sites, which means that the veins are very hard to find. Then the next option is to drill into the bone because you want this medication to be administered quickly. All right. So now we'll talk about let's skip the subcutaneously first because it ties with transcutaneous, but we'll move on to intramuscular. With the intramuscular injection, intramuscular means that it is into the muscle. Alright, usually medications that are administered by intramuscular injection are absorbed quickly because the muscle have a lot of blood vessels. However, not all medication can be administered by the IM route. Possible problems with IM injections are damage to muscle tissues and uneven, unreliable absorption, especially in people with decreased tissue perfusion or who are patients that are in shock. Right? I'm not sure all of the medications that are administered via the IM route, which is the intramuscular route, but they penicillin is used intramuscularly. All right, so you can know that. All right, so now we'll talk about the subcutaneous route and the transcutaneous route. First, the subcutaneous, which means under the skin. All right, all right. This subcutaneous means beneath the skin. An injection is given into the tissues between the skin and the muscle because there is less blood there here than in the muscles. Medication that are given by this route are generally absorbed more slowly and their effects last longer. In the subcutaneous injection is a useful way to give medications that cannot be taken by mouth, as long as they do not irritate or damage the tissue. Alright, so daily insulin injection for patients with diabetes are also given by the SC route. And I believe that immunizations are also done via this route. All right, so in um transcutaneously now. All right, so with the transcutaneous route, which means through the skin, some medications can be absorbed transcutaneously, which mean such as nicotine in patches, used by people who are trying to quit smoking. On occasions, a medication that comes in another form is administered transcutaneously to achieve a longer lasting effect. An example is the adhesive patch containing nitroglycerin. So persons who are trying to quit smoking, yes, will use a transcutaneous patch. A person that wants to have birth control will use a transcutaneous patch. Persons that have seasickness use transcutaneous patch because it transmits through the skin into the bloodstream. Okay. All right. Then, all right. For the last three, now they have the inhalation. Inhalation is medication that are inhaled into the lungs so that they can be quickly absorbed into the bloodstream, or that so that they can be absorbed into the bloodstream more quickly. All right. Others are inhaled because they work in the lungs. Generally, inhalation help minimize the effect of the medication in other body tissues. Such medications comes in the form of aerosols, fine powders, and spray. Then you have sublingual. Sublingual means that it is administered under the tongue. Medication is given by this route as a nitroglycerin tablets. Enters to the oral mucosa or mucosa under the tongue and are absorbed into the bloodstream within minutes. This route is faster than the oral route and it protects medication from chemicals in the digestive system, such as acids that can weaken or inactivate them. Alright, so that is it for today for the first part of pharmacology. Alright, please go over the information. We said earlier that pharmacology is the science of drugs, including their ingredients, preparation, and yes, preparation, uses, and actions on the body. All right, we mentioned that there are two different methods of administration. We have the enteral, and the parenteral. All right, and then we talked about those that are that go through such methods, right? I hope that you have learned something. All right. So please go over the information, and then for the next class we'll talk about the 6 rights and rights of medication administration. Do have yourself a wonderful day.